Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Okay. WHO classification of the breast carcinoma. According to WHO classification of the breast carcinoma, first we have in situ carcinoma. In situ carcinomas are of two types. One we have ductal carcinoma in situ. Ductal carcinoma in situ. Second we have lobular carcinoma in situ. Then we have invasive cancers. In the invasive cancers, these include ductal carcinoma is the most common invasive cancer. It is most common. Then we have lobular carcinoma. Then we have tubular or cribriform carcinoma. Then we have mucinous or colloid carcinoma. Then we have medullary carcinoma, or we have papillary carcinoma. Then we have metaplastic carcinoma or inflammatory carcinoma. So these are the different types of carcinoma breast. Then we also have the next type, which is Paget's disease of nipple.
thank you and thank you for watching.